Hello,
Yes.
sir. I'm trying to get in touch with a Mr. Meditz.
This him.
Hello, this is Mr. Meditz.
Yes.
Awesome. Okay, good to meet you, sir. My name's Dr. Kirpin. Real quick, do you mind confirming I just want to make sure I'm speaking with the right person.
Yeah, of course.
Well, good to meet you. My name's Dr. Kirpin. I'm a psychiatrist at the Salem VA.
Yes, sir. Thank you for giving me a call.
Yes, sir. So I was giving you a call, and by the way, I believe you are actually scheduled for an initial appointment with me in a few weeks. So I just kind of wanted to reach out and introduce myself.
Yeah,
I believe you.
Yeah, I'm sorry. Yeah, actually, just had a call. I got a psychiatrist appointment next week in the community, and I'm supposed to have something else too. But yeah, I've got some appointments coming up. But yeah, I appreciate that. I can't remember when we're supposed to meet up, but yeah.
Okay. Well, that's good to hear because I believe you've seen a couple of the other psychiatrists here at the Salem VA in the past.
I try to, yeah.
Okay.
Yeah.
I believe you saw a physician assistant by the name of Young. I believe you saw one of the resident psychiatrists as well. I just want to clarify: are you receiving mental health care in the community currently, or are you?
I'm in a process of.
Okay, so you're not established yet.
I've got my first appointment next week, May 6th.
Oh, okay.
And then I was supposed to have and that's for psychiatry. And then I was supposed to have, and I'm trying to follow up with the psychology one. That's supposed to be, because I was supposed to have a community care nurse for psychology as well.
Okay. Yeah, that's good to know. So it looks like an appointment on the 6th, so that's just about 1 week from now.
That's correct. Yeah, she just called up today and whatnot, so yeah.
Okay, do you know the name of the provider and the name of the clinic? Just so I
can... yeah, if you give me a second, let me put on speakerphone so I can go through my email.
Absolutely, yeah.
Yeah, they, let's see, last. Okay, here we are. So it's what's the name of the place? Center for Care and Resiliency, PLLC, and I just look at these.
All right, and you're meeting with Christopher.
Pardon me, PLLC.
Okay.
What's that psychiatric? I don't know what the thing is.
Okay, but it is going to be with a medical provider.
That's correct. Yeah.
Okay.
As far as I'm tracking, yeah. I mean, yeah, I don't see like a doctor in front of me or however it goes, but it is for psychiatry. So we'll see.
Okay. Well, I'm glad I called then. Just want to let you know that if you are started on any medications, and this is just kind of like general practice, not just for you, but for all of our patients who are getting mental health care. If you are started on medications, psychiatric medications, or any medications outside of the VA, it's really important for you to call and just let us know, just so we know what you're on, and also because you don't really want two different psychiatrists prescribing you.
I don't want the VA prescribing me anything because they don't know how to diagnose me, and they want to say psych ward for everything.
Oh.
And they won't give me medication for sleep directly, for my insomnia directly, which Lunesta actually works for me, and medication actually works. I told them Ambien doesn't work, but they gave me a prescription of that, and so I don't know why they can't give me Lunesta. That's what the medication actually works, but they want to put me on quetiapine, Seroquel, where I had a parasomnia episode of sleepwalking for 6 hours, performing acts of self-harm, and I was conscious. I couldn't stop myself from doing this stuff. can't give me Lunesta. That's what the medication actually works. But they want to put me on quetiapine, Seroquel, where I had a parasomnia episode of sleepwalking for 6 hours, performing acts of self-harm, and I was conscious. I couldn't stop myself from doing this stuff. And so it's like they put me on. They won't treat me for what actually ails me, but they want to put me on these powerful antipsychotics and whatnot. And it's like I tell them I have very bad side effects with them because I'm not depressed, sad, or whatever they're trying to say. And that's of course, I'm looking like a maniac in there because I'm pissed off because I go in for pain and they tell me that, well, it's kind of hard to treat you until you get your mania taken care of. And it's like, I got retired from the Army back in 2012. I was enlisted from 2008 to 2012. Mecca retired as an infantryman. I was in Somalia, Iraq, 2008, 2009. And I have shoulder, back, and head. And I went in for a pain flare on February 23rd of 2026. The doctor said, hey, come back in 2 weeks if you're still having any issues. I go back 2 weeks later because I'm still having any issues. And the doctor is like, well, we look at your MRI from 2010 when I was still in the Army, and it shows a mess, but we can't treat it. You know, it seemed like 170 was doing well. And how is it that I don't belong I can't get into the PTSD program? And at Veterans Affairs. I tried going into the PTSD program, but I can't get into that. You know, I'm a freaking combat infantryman. And but they want to put me in a psych ward because I freaking raised awareness. I had to get I was assaulted November 25th of 2024 and had my nose broken badly. And I was supposed to have surgery April 1st, 2025. I didn't have it until April 1st, 2026. I had to call the White House to get things done, and that's the thing is. So I have an actual symptom. You know, things are going on, and they've affected my sleep, and they wouldn't do any. And so that's why I had to call the White House again to get because, and also the Megan Pittman, my substance abuse counselor, for making outrageous claims saying I'm going to bring a gun.
Okay.
Yeah, and so I apologize for going off. I mean, but like that, you know, it's
okay.
Instead of actually addressing the actual concerns, they just want to bring, like, you know, they want to turn everyone into a mental patient. I just finished my courses for this term. I'm going for my bachelor's in business entrepreneurship. I'll have it done next year, next April, and whatnot, maybe sooner. You know, like my life is. I don't know where these people are coming from that. Like I belong in a damn psych ward because I'm trying to get my quality of life back, and so that's the situation.
I know,
yes, sir.
Yes, thank you for
thank you for listening.
Of course, thank you for sharing all that with me, and of course, I know you've been through quite a lot, so thank you for sharing all that with me, sir.
Yes, sir.
I will say that, you know, again, I wasn't there, so I can't really speak for exactly what my colleagues were thinking in the moment, but I can tell you that. The Unit 170, which is what we call the inpatient psych unit here.
Yes. That
is kind of an acute stabilization unit, if you will, like a crisis stabilization. So when somebody recommends Unit 170 or brings you even involuntary hospitalization 170, it's not really a forever thing. It's supposed to be like a short term.
It's punishment. They've done it to me countless times.
I'm sorry that it was a bad experience for you, sir. I really am. It's not a punishment. I'm sure they were trying to get you resources and help you.
No, they didn't. No, okay. And like this, this last time because and that's the damn thing is freaking complicated. You know, like simple things get exasperated by Veterans Affairs because they do not handle them. They instead of treating actual, you know, what's going on, like I freaking am suffering. Was suffering and freaking. So what's very complicated is even more complicated. In Veterans Affairs, and like there's no one there, and it's like I have to just jump through all these damn hoops, and it's like. There's a reason why veterans are committing suicide, and it's because we're not being heard.
Okay.
You know, and 14 years I've been doing this. You know, when I was
I
in the
do hope.
Army, I freaking got me, you know, under staff training, command sergeant major, 33 years to resign rather than face court martial with a report I brought to him. The Brigadier General Keith W. Gallagher, Pacific Medical Command. You know, I was in the Warrior Transition Unit. Like, the medical system is flawed from the military all the way to the Veterans Affairs. You know, I don't have full movement, my leg and such, and you know, I'm trying to figure out what's going on with that. But they just want to, you know, say it's psychosomatic. Oh, you do cognitive behavioral therapy, and it's like, do breathing exercises. I can't breathe. My nose is broken and stuff. Like freaking, and it's like these people, like, and my records are all tainted.
Sir, can you take can you just give me a moment?
Yeah. I'm sorry.
Okay. You've been through a lot. You've been through quite a lot. Now, are you on any psychiatric medication currently?
No, because I don't need anything. I need help with my sleep.
Okay.
That's what I need. You know, directly. They put me on antidepressant. That's why I have bad side effects. I don't know, because I'm not.
You said you feel like veterans are not being heard, so I want to hear you now, and I need to ask you this important question: are you having any thoughts of wanting to harm yourself right now? Do you feel safe where you are right now?
Depends. I mean, Veterans Affairs. I mean, freaking banging Pinton saying I'm trying to bring a gun.
Well, you mentioned
that's not really too safe. And I don't own a gun, don't have possession of a gun, don't have any means to get in a gun. You know, and that's what these people do. They're sick. You know, and because I'm freaking frustrated because the system is failing me, and I'm in pain, I'm suffering, I'm tired, and that's the damn thing too is lack of sleep. All the symptoms that they're explaining that I have. Yeah.
I need to ask you. You mentioned veteran suicide, so I need to ask you.
I'm not suicidal, homicidal, genocidal, or any of that. I brought up a point because freaking, like I said, there's medication that works for me, and Veterans Affairs is withholding it.
Okay. So I want to ask you about that. Now you're saying you're having a hard time sleeping?
I've been, and oh, bless you. Like when I was in the Army, they prescribed me Lunesta. Like I was on Ambien, they prescribed me Ambien CR and the control release, and it didn't work with me. The only thing that worked for me was Lunesta, and it sucks because like every morning you wake up and it feels like it tastes like you sucked on a battery all night. But it's the only one that actually worked for me. You know,
How much
and
have you been sleeping recently, would you say?
I'm sorry.
You know, over the last, let's say 2 weeks, how much have you been sleeping, or how have you been sleeping over the last 2 weeks?
I slept maybe like 2 hours last night. And
are you waking up feeling well rested, or are you feeling tired when you wake up?
I don't. It's just like the same state. You know, like saying like tired. And I mean, and that's the thing too is like I'm on caffeine like hell right now too. I have my energy drink, and so part of it from being a little bit more frazzled and such or amped up. But yeah, so yeah, like I mean, 30. I'm up for like at least 30 hours. You know, like at least on a regular basis. And it's like I can't. And it's like the only way I can actually go to sleep is like to pass out and stuff. And, you know, I've cut back on my drinking drastically. Like, I mean, I was drinking like a 12-pack a day, like, you know, over a year ago and such. And now I drank, what was that time I drank? Like I had a couple beers, beer night. What was it? Sunday? Saturday? Yeah, it was, I was watching wrestling. It was a Saturday.
Okay.
And but yeah, I haven't been drinking all that and stuff because I've been having like some other issues too, and it's like was sweating a lot. I actually was in the ER early last week because it was dehydration and I was throwing up, couldn't keep anything down, and all that, and yeah, and so it's like I would just run myself into the ground.
What drink do you think?
I'm sorry, sir.
When was your last drink, do you think? Alcohol?
It was, like I said, Saturday night, or like Saturday into Sunday morning.
Okay. Just kind of a question I need to ask.
By all means.
Have you ever had any complicated alcohol withdrawal, like
No.
bad problems from alcohol withdrawal?
No. I've never had any issues with any coming off of any substances or anything.
Okay. All right.
Yeah.
Any substance use recently on your part?
I smoked marijuana. I use marijuana.
Okay. All right.
And
how often
that's
do you
it.
use cannabis?
I'm sorry? Well,
marijuana, cannabis, how often do you think you use that?
Oh, yesterday, like last night before I went to, or this morning when I went to sleep, should say.
Okay. Any other recreational drugs? Things like meth, cocaine?
I'll do I use psychedelics, mushrooms, and acid. They've been really helpful the last few months and such. Really helpful. Like doing some regressive therapy and whatnot, and been able to really overcome some things and put myself in a better place. And it wasn't easy, good God, but you know, and like it's not for the faint-hearted and stuff because you get go into dark places and whatnot. But yeah, he's able to come out of it all good, and it's not something that, like I said, do recreationally and stuff like that. The psychedelics actually, they do help me. Like when I had that parasomnia episode in December, oh man, like that, I don't get spooked, man. And like being in like out of control of my body, and I'm like, I bashed my head into the bathroom mirror until it broke. That's when I finally woke up, and like, I mean, so like I was lucky I didn't lacerate my feet and all that. I mean, like, geez, like, I mean, like it was bad, and I like I said, I never had side effects from like the psychotropes, the antidepressants, manic, the bipolar stuff, like that. I don't deal well with those. Even when I was in the Army, I never dealt with them well. And
sir, there's a concern.
What's that?
We're talking about your past medical history. There's a concern that maybe you have bipolar disorder. What are your thoughts?
That's PRCC. Elizabeth Stein. She says she doesn't think I do.
Well, what do you think?
I don't. I'm pissed off because the system is broken. The system is broken. I've been dealing with this for 16 years, with the Army included.
Because there's also a concern, there's a concern that you've been, we use the term manic, which you probably know what that means. It's when somebody's very, very elevated, has a bunch of energy, very distractible, like can't really stay focused on anything.
See, this is what thank you. You're doing exactly what I'm talking about. I'm telling you about actual things, environmental things, and freaking 14 years of abuse. And you're just labeling me fucking manic?
No.
Yeah,
sir,
see, this is why I'm going outside the community.
Mr. Meditz, I'm not.
This is what, you're go ahead and check all your boxes. Have fun.
No, I'm not.
Whatever. This is what happens. I freaking start trusting and I freaking put faith in the system, and then all of a sudden make myself vulnerable, and it's like, no, I don't trust any of you over at the Veterans Affairs. You've taken my rights away.
I understand. Well, I don't want to take any of your rights away.
Well, you did. I mean, like, not you personally, but yeah, 2014, going for pain, and freaking all of a sudden I'm in box with security, and then I'm strapped to a bed, and then I'm temporary detention ordered for threatens with 30 days. But freaking, I signed my rights away because I can't afford 30 days because I don't have anyone in my life. So I freaking signed my rights away, my gun rights, became a red flag vet because I went in for freaking pain because the teacher freaking decided to freaking make a false claim about me and say that freaking I was getting shipped up damn school because she freaking cut classes and I was going to report her. My first quarter at college, Green River Community College, I got Daniel J. Garcia fired, an instructor who shouldn't have been hired in the first place. Freaking, y'all don't know. And it's like freaking, just because I'm freaking handle myself this way, it doesn't mean I'm freaking manic, bipolar. You just throw labels. And that's why I freaking have side effects from these drugs, these hard drugs that you give us vets, like Seroquel, quetiapine, quiet the pineal gland. You don't want us to, you want it all to shut up.
Mr. Meditz?
I'm going for pain and it's freaking blowing 170. I got that recorded. That's why I've got to carry a body camera with me. People are saying I'm going to bring a gun. What, you're making shit up? I'm sorry, I'm not going to be freaking a little passive and nice and complying when people are making these outrageous claims against me.
Mr. Meditz, may I finish what I was going to say, please?
By all means.
What I was saying is that I was looking at your chart, and some
Yeah.
providers previously
They don't know their elbows from their assholes, and my records are tainted. That's why I'm going to the White House. That's why I'm going outside providers, because y'all messed my records.
May I please finish what I was going to say, please?
Yeah, you're going through my records, and that's what it says. A bunch of other people said that stuff. And you're also seeing that they threatened them to bring a gun. So their records mean nothing to me. So you can go over them all you want. You can check your boxes. That's why I'm not listening to y'all.
Okay.
I mean, but go ahead. I'm done.
So what I was going to say is, even though it's in your chart, possible bipolar, manic, right? Like in the past, that's what some providers thought previously. But there's also, looking at your chart, there's also concerns that, and a possibility like, well, maybe that wasn't actually mania. Maybe he was under the influence of a substance, like a stimulant, like cocaine or something at the time.
No,
what are your thoughts on that?
Oh, because I'm not being heard. I go in for pay, and they call me crazy.
Nobody's calling you crazy.
Yeah, bullshit. Yes, I got it on record. I got record videos of it. That's why I got body camera. They're saying we're gonna bring a fucking gun to campus.
Okay.
You know what the hell? You know what? That's why I gotta record myself. That's why I gotta freaking. Cause I don't have people. I got called on live by the Commonwealth Attorney's Office. And they said I said something. You know what? 3 Commonwealth attorneys against me. I got fucked.
Mr. Meditz, if talking with me is upsetting, is frustrating or upsetting, we don't need to carry on the conversation.
But you're asking me questions, and then you're getting, and this is what happens. Y'all ask me questions, and then you get upset with me because freaking I'm not freaking, and it's like, because nothing gets done. I keep on repeating myself, and it's the same damn thing for 14 years, and there is no help. Freaking I go in for pay, and then freaking, and it's like, well, you know what? It's all in your head. It's all in your head. Y'all are sick.
Thank you for sharing that with me, Mr. Metz. I know you're probably going through, I can tell that you're going through
hell,
a lot.
man.
What was that? I'm sorry.
I'm going through hell with Veterans Affairs. And asking for help is the worst thing I ever did. Believing and trusting people. Putting my faith into a broken system.
Okay. So I just want to clarify, you told me that you don't want to receive any medications from the VA. Is that correct?
Unless you're going to treat my insomnia solely. Unless you're going to, prescribe me with something that freaking actually helps, like a chill pill, freaking something I can take or whatever, so I don't have to smoke pot to, get the same effects. But you just want to throw all these heavy medications instead of actually just doing management and such.
Mm-hmm.
And freaking say bipolar, you say mania, you all say freaking whatever the hell it is, just to avoid dealing with the damn problem, which is freaking a vet is in pain. And it's not being addressed. And I had to call the White House to get freaking my nose job done because freaking they changed it over a year. And you're saying I'm freaking crazy, a maniac, I'm a bipolar freaking maniac because freaking I'm pissed off because freaking something so simple. I had to go to the White House to get done.
So I'm looking. I'm just curious. Were you able to talk with anybody at the White House?
Yes.
Okay.
I was able to. I got my. I addressed my concerns and called up yesterday. There is some action, but freaking. I changed things in the Army, and I didn't think I could. The entire military, I should say, the healthcare system, with my report, Pacific Medical Command. And it's like freaking, I've got enough evidence as it is to freaking show systemic abuse, like failures by Veterans Affairs. And I'm right here by a hospital. It's like protest time.
Okay. So, Mr. Meditz, talking about medications, I'm looking at a list of your previous medications right now.
Yeah, from Veterans Affairs. They never.
Yes, from Veterans Affairs. Yes, sir. Would you like to go over those?
No.
I can go over those with you if you like.
No, because freaking they don't. There are a bunch of freaking things that I need something for sleep, but they want to put these bipolar things in there. They want to put these other fillers in there, and they don't.
Okay, well, we can talk about medications for sleep, sir. We don't have Lunesta here. That's not formulary with the VA, but there's plenty of other medications we use for sleep all the time.
Yeah, that's also antipsychotics that you like to try and squeeze in.
Well, there's.
Yeah, unless it's something directly for insomnia. You know, like I can't even. Why is it that people that freaking like are able to get Xanax, Klonopin, they're able to get all these other pills, and they're freaking and just because freaking they got slapped by their dad when they were a kid, you know, and it's like freaking here I am freaking a disabled combat infantryman, and I can't get freaking anything unless it's a freaking antipsychotic. You know, it's like because that's what they want to do. Just turn us all in mental patients. Rob us of our quality of lives.
So there are some medications that are approved for insomnia. As a matter of fact, I believe when you were in plenty of other medications we use for sleep all the time.
Yeah, I've addressed my concerns and called up yesterday. I mean, there is some action, but freaking it's disabled. Why is it that
I'm looking
problem, which is, and it's not being addressed. Freaking, and I had to call the White House to get freaking my nose job done.
I can go over this with you if you like.
No, because freaking they don't. There are a bunch of freaking things that I need something for sleep, but they want to put these bipolar things in there. They want to put these other fillers in there, and they don't.
Okay, you know, well, we can talk about medications for sleep, sir. We don't have Lunesta here. That's not formulary with the VA, but there's plenty of other medications we use for sleep all the time.
Yeah, that's also antipsychotics that you like to try and squeeze in.
Well, there's.
Yeah, unless it's something directly for insomnia. You know, like I can't even. Why is it that people that freaking like are able to get Xanax, Klonopin, they're able to get all these other pills, and they're freaking and just because freaking they got slapped by their dad when they were a kid, you know, and it's like freaking here I am freaking a disabled combat infantryman, and I can't get freaking anything unless it's a freaking antipsychotic. You know, it's like because that's what they want to do. Just turn us all in mental patients. Rob us of our quality of lives.
So there are some medications that are approved for insomnia. As a matter of fact, I believe when you were in the when you were in Unit 170, you were. I know they gave you Seroquel, and you weren't a fan of that. You said
Parasomnia, yeah.
I believe they were also given it for. I believe they were also.
Yeah, but it's also friggin' a strong antipsychotic. That's what I'm talking about. You know, it's like you know, you keep on trying to sell me on it, and it's like you're not. And this is the damn thing. It's like I already tell you what's going on, and you're just trying to. Hey, well, let me just try to get this antipsychotic in you.
Well, if you don't want a medication that's, you know, if you don't want an antipsychotic, right? You use the term antipsychotic.
I want insomnia medication. That's what I want.
There are some medications that are approved, like actually approved for insomnia. Now, a lot of medications in psychiatry that work for insomnia aren't technically approved for it, but we still use it for it because they're really good for it, right? If something's approved, that just means the FDA has approved it, meaning they ran clinical trials on it.
Lunesta is the only prescription drug that works for my insomnia. If you can't give it to me, friggin', and you're not providing me any alternatives that's directly associated for like insomnia, that's like, yeah, what's the point? And then it's like, if I can't even get a chill pill, for when things get escalated for me and stuff, and it's like, it just,
so
like,
if you don't,
yes.
So yes, we don't have Lunesta, so I can't prescribe you that. But if you insist on a medication that's actually FDA approved for having a difficulty sleeping, insomnia, sleeplessness, there is diphenhydramine. You could try diphenhydramine, sir. That's FDA approved for sleeplessness, and we can prescribe that for you if you like.
I mean, I'll give it a shot. I'll look it up when I get back from my appointment and such. But yeah, I mean, most likely it's probably got some antipsychotic crap in it, and so it's worth. And I'm not going to take it.
No, it's not. It's not. Diphenhydramine is not an antipsychotic.
And I can't even get a benzo and stuff. You guys say I'm like all freaking crazy and manic or whatever else. I can't even get a freaking chill pill. You're like, and that's the damn thing. It's like, and then you get mad at me because I use my drugs because I can't get your drugs because y'all withhold them. You're gatekeeping.
Would you don't, just to be clear, like, we can't force you to take anything. You don't need to take the diphenhydramine if you don't want to, sir.
Well, I'm going to, I have to look it up and stuff. I mean, I appreciate the offer, but I'm not too certain how effective it's going to be.
Okay. Do you want to look it up and then at your convenience call?
I mean, I don't have, I mean, it's just easier to,
I don't. Yeah. I don't want to prescribe it for you if you're not going to take it at all, right?
Well, I don't know what it is. I mean, like, and I told you I've got an appointment that I go to, and it's like
diphenhydramine. I mean, have you ever heard of Benadryl?
I'm not taking it because I get restless leg syndrome.
I get
restless leg syndrome from Benadryl. Sometimes it works. Sometimes, most of the time, it doesn't. That's why I say Lunesta.
Okay.
Y'all don't
have Lunesta, sir.
Right. I don't understand how y'all don't have it.
But there's plenty of other medications that we use to help people sleep.
Well, it's got to be like Lunesta.
There's medications like.
Oh my fucking God.
Okay. We don't need to carry on the conversation if you.
Well, I'm a broken record.
What?
I'm a broken record. I keep on saying the same thing over and over and over, and you keep on trying to sell me on something. I tell you what works for me, and you're coming up with alternatives that aren't even close to it. So thank you for gatekeeping. There's medication out there that can actually help me, and you're withholding it. Because instead of like just trying something out, y'all's egos make us suffer, man.
There is a medication that's approved for the short-term treatment of insomnia that's controlled, but it's called Ambien.
Oh my God! I told you. I've said Ambien before. I said that y'all prescribed it to me at Veterans Affairs, and it doesn't work. I've been on Ambien CR. It doesn't work.
Okay.
Oh my God! Don't listen. And then you wonder why I'm all angry and mad because I say the same thing over and over and over again.
Okay, sir. If again, you don't need to have this conversation with me. We can end the phone call if this phone call's upsetting you. I apologize. If you'd like to end the phone call, that's totally fine. You aren't going to.
If you would like to help me, I mean that's totally. I mean you're the one that's.
I would like to help you, sir, but we don't have Lunesta, so it's not formulary here. And there's
there's other things out there. And that's the whole thing. I don't know what's out there because y'all haven't even tried. Well, you tried, but you tried to throw these antipsychotics in there. I mean, that's why I'm going to the community care because you know what? Maybe the community can actually prescribe you Lunesta.
Okay. Do you want to see what community care can do, and then you call and update us whether they start you on Lunesta, sir?
I mean, if I'm going to community, y'all can talk to community. I'm not. I mean, I don't need to talk to y'all.
That's true.
I mean, like, I don't. I mean, like, I mean, the thing is, like, I've had to go outside to care for my physical stuff and my mental stuff. I'm going outside. The VA is basically useless to me.
Okay. Well, to be clear, sir, I just want to be clear. You know, the doctors here at the VA and the nurses and the social workers and all of us, we work for the Veterans Health Administration. We don't have anything to do with your benefits, your service.
I'm not talking. Well, the Veterans Affairs Hospital. I'm not talking about my benefits. I'm paid.
No, I know.
I mean, I'm not worried about my benefits. I'm not worried about anyone affecting my benefits because I went to the Integrated Disability Evaluation System. My stuff's locked in.
And sir,
like, I'm not worried about that.
That's what I'm saying. And that's what I'm saying.
I'm talking about my health care. Oh, yeah. Like, I'm not. Like, yeah. See, oh, my God. Like, I just.
But I just want you to know that you can.
I do know that.
We're a resource for you here, sir. You can see us, or you don't need to see us. Like, it's totally up to you. If you say that we're not helping you, you know, our job, our duty is to.
You're not. There's a psych ward for everything. The psych ward for everything. I tell you what's going on, and it's like, hey, well, how about this one? Oh no, that's an antipsychotic. Then like just for insomnia. Like there's countless medications out there that and you're just avoiding treating me. You know, you have the knowledge. You know,
So would you? I just need to. I want a yes or no answer if possible. Are you open to receiving medications from us for insomnia if it's not Lunesta?
I'll look into it. And if you're going to prescribe me something for insomnia, freaking prescribe me something for insomnia. I mean, like, if I'm going to take it or not, like, I've got to look at. I don't know what you're going to surprise me with.
I would recommend trazodone. It's not an antipsychotic.
That stuff doesn't work. Oh my God. Oh my fucking God. God damn it. Oh my God, man.
Have you tried?
And it's time for insomnia alone, man. Like, I'm paid for insomnia. You know, it's in my freaking records. PTSD with insomnia.
Are you having nightmares? You say PTSD related insomnia. Are you having nightmares, sir?
I haven't slept in weeks.
Okay. But when you do fall asleep, do you have nightmares that wake you up?
They happen. Not all the time, but they happen.
Okay. Have you ever taken medication for nightmares?
What? Oh my fucking no. Okay, freaking. I'm not gonna take Okay. See, surgery. Oh my. Like. Okay. Insomnia. My sleep. You see? This is what y'all do. You make us freaking insane because you keep on asking the same question like freaking lawyers.
Okay, I'll stop asking questions, sir. What I would recommend you do is I'm just going to say a couple of names, and you can think about it, and you can research them if you want.
Dude, there's an insomnia medication. Prescribe it. Just prescribe me. Like, do something.
I cannot prescribe you medication unless you're open to it.
I just told you.
Okay.
If you can do something to help me with my insomnia, that'd be great. Thank you.
Okay. So Benadryl, diphenhydramine is approved for insomnia, but you don't want to do that, correct? Or are you open to it?
You're doing a bare minimum to help me. And freaking, you're just doing something just to appease your freaking superiors and say you did. I'm not giving you that satisfaction.
Okay, all right, sir. We're a resource for you. You don't need to take advantage of this resource, but we're here for you.
What resource are you providing me with? You're not helping me with my insomnia. You're not.
I'm trying to give you options to help you sleep. Lunesta is not one of the options, but we have other options.
I've got a few minutes before my freaking. Let me.
Now,
I'm gonna look up
there
insomnia medication and see what I can find real quick. I'm at my appointment, so insomnia medications. So what about orexin, zolpidem?
Zolpidem is Ambien, sir.
Okay. Well, that's just D drugs. What about temazepam?
That's a benzodiazepine. That's short-term treatment. That is approved for treatment of insomnia, but we.
Well, how about that? So then, how about that? It's because I'm not trying to do this long term. I'm trying to actually get into a sleep study. I'm trying to do something more to find out, to get to the root cause of my sleep disorder.
Okay. In order to because so the temazepam, that one can help people fall asleep. The issue that one.
So then what's the problem?
Well, that one's slightly less user-friendly because we need you to come in first and have a drug screen, a urine drug screen, in order to start controlled medication. So it would take a little bit longer.
Well, I didn't do that for Ambien.
It should have been done before.
I didn't. And so there's more gatekeeping.
Okay. But, I mean,
so I'm telling you something that, like you said that you can do it. You can't. When can I come in for a drug screen?
What was that?
When can I come in for a drug screen?
Whenever you like, sir. The lab's open.
Okay,
every day.
So I'm gonna go in for a drug screen. So I can go in. What do I do? Just go to the lab?
Go to the lab, but again, it's going to need to be a negative. It's going to be a negative drug screen, sir.
Right? So for what? For what? Marijuana?
Including marijuana. We cannot give you a controlled medication if you're using recreational drugs, sir. And that's because
I'm using marijuana to help me with my illness, because the VA won't has not given me anything. I gotta freaking go through. I gotta be sober. And so
sir, one thing to consider too with the temazepam is, even though it can help people fall asleep, it is habit forming long term.
Oh my god! I haven't done drugs before. I have to use drugs because the VA will not give me their drugs. I use mine. And so you're forcing me to use my drugs again, because rather than actually just help me deal with the issue, I got to freaking has a drug screening. So freaking, all right, so y'all really just don't want to help. See what I'm talking about? There's options out there, but you're just not doing them.
Sir, I can assure you that I do want to help you.
Oh, no, I can assure you that you don't.
As a physician, my job is to offer you good clinical judgment medications
you're just gatekeeping. You're abusing your power. There's something that works. You're freaking. There's ways to color outside the lines on this a little bit.
Okay, thank
but
you.
You're just choosing not to. So I appreciate you for being a gatekeeper and not helping me. Thank you for wasting my time.
Thank you. And, thank you for your time, sir. I look forward to seeing you May 20th. Okay. And I will ask. What was that?
I'm not really looking forward to that appointment. I mean, freaking, this is the way we went. So what are we seeing? Like, what do I see you for on the 20th?
That's going to be an initial intake appointment with the mental health clinic.
For what?
So an initial intake appointment, it's a full psych eval. It's like an hour and a half.
I'm going to the outside community, so why do I need to see you?
You don't need to see me. It's just I'm here for you. We're part of your resources. We're happy to see you.
I mean, if you can't help me with a medication to help me sleep, and stuff, because friggin' marijuana use, that's part of my PTSD with cannabis abuse. I'm in a substance abuse program, so you really just don't want to help me. Thank you.
Okay. Well, I look for your appointment.
Yeah, I'll just let people know. I'll call the White House again and let them know about this. So, thank you.
You're welcome, and thank you, sir, for your time. Your appointment's May 20th at 9:00. Okay, and it's a virtual appointment.
Sounds good.
Okay. Thank you.